Hello and welcome to our show, Dying to Know. My name is George Herodes and I'm with the Mount Elliott Cemetery Association. Most of our viewers know of our Guardian Angels Cemetery in Oakland Township and of course our Resurrection Cemetery in Clinton Township. The goal of our program is to bring you topics and guests that will help you make life's important decisions that will help you protect your loved ones. I'm excited to bring you our guest today, and we have a prominent member of the community I'd like to introduce you to, and that is Joanne Lagman. And Joanne is from Home Helpers and Direct Link, and welcome to our show today.
Oh, thank you, George. It's great to be here.
You've got such an extensive background in healthcare and medical. Would you tell us a little bit about yourself and your background?
Oh, okay, certainly. Yeah, I've been in healthcare a long, long time. And as a non-clinician, I have worked for most of the large healthcare systems. I started out in an ambulatory center, and from there went to the inpatient arena. I've been responsible for managing, admitting, surgical boarding areas in hospital systems. I've been the director of ambulatory for a couple of the hospitals in the community. Primarily, I'm a Michigan person, southeastern Michigan person, so it's really been all the big hospital systems in southeastern Michigan that I've worked with. Then about 2006, I got an opportunity to not manage other hospitals or hospitals organizations. I got an opportunity to manage my own and acquire my own business. And in 2006, I acquired the office of Home Helpers and Direct Link. And originally we were in Romeo, downtown Romeo. We have grown, and our office now is on Van Dyke between 30 and 31. We're in Washington Township.
I've been there. What a great staff you have.
Well, thank you.
I really enjoyed my visit there with everyone.
Thank you.
And of course, everyone knows you. When you mention your name in the community, everyone knows you.
I've been around a long time.
It only seemed like the natural progression for your career to have your own. So,
oh, yeah.
You must be very proud.
I'm very
you have
proud.
an exceptional reputation.
Thank you.
So,
thank you. We work very hard at that.
Would you tell us what kind of care you provide in the home? What kind of care can people get for their loved one in their home?
Sure. Let me start by telling you the difference between the different kind of care you can get.
Okay.
There is skilled care. That's the Medicare certifying the certified agencies that can bring in RNs, physical therapists. Typically Medicare or health insurances pay those kind of services. There's also hospice that can come in and help people during their time and their passing. What we do is considered non-medical home care. We started out, it's called private practice. It's where years ago RNs used to go out into homes, and so they called it private duty. And that's kind of a term that's familiar in the industry. When people say, are you a private duty agency? What it means is, yes, we do the non-medical kind of services in people's homes. Everything from homemaker services, where we come in, we do housekeeping, light housekeeping. We can cook meals. We can help our clients with transportation, taking them to the doctors, taking them out to lunch. It's what I like to say. It's like having a lot more daughters. We come in and we help folks with those everyday activities, and primarily our population that we support is our seniors. We can support individuals who are not seniors, but they've had some kind of medical condition or surgery or injury that now they need some assistance with those everyday activities in their home. So we come into the home and help them with that until they're better and they don't need us any longer.
What a great service, because something like this wasn't around years ago.
No, and people didn't know about it.
No, and my mother died at 60 and was very ill for a long time. And we were, as her children, we had to take off work at times. We didn't know anything that a service like yours was around, or if it was then, and it wasn't common knowledge. So we had to do a lot of this ourselves and trying to still work for a living, and it was very difficult.
It's very hard on families to be caregivers.
To know that there's something like this now is just great.
Yeah. Home Helpers has been around since about 1997. It's a franchise. Our office, like I said, we've been around. I acquired it in 2006. It really was started by someone else before me in 2003. And even now, George, even now, people don't, the general population doesn't know that this kind of service is out there for them. Unless they've listened to a program like this, unless they've gone to some kind of community, whether it's a senior center or somewhere, and the literature and information is there. Some of the rehab centers know about this kind of service and can give give information to individuals because, like I said, general population still doesn't know that they can bring help into their homes.
We're going to mention your phone number a few times during the show,
Sure.
but I'd like you right now just to share with the audience
Okay.
where they can reach you for maybe some more questions.
Sure. Oh, I'd love to. Our phone number is 586-752-3797, and we really do have even an after-hours phone number, and that's one of the good things about a stable agency that we have is the fact that we really have 24 hours, 7 day a week attention. Wow. So during business hours, the regular phone number. In case of emergency, there's a cell phone number that they can get off the primary phone number so that we can be reached 7 days a week.
And how comforting that is, because if something happens in the middle of the night, you don't feel like you're alone.
Yes,
So.
yes. And our clients and our caregivers, they need to be able to reach out to us. Life doesn't always happen 9 to 5, Monday through Friday.
Exactly.
So
it's
we
never
really
that
do.
convenient.
That's right. So we really need to be there for people.
So now that there are some of these companies popping up in neighboring communities, what sets you apart from the rest? What do you feel is your, why should people
think about us, and consider us? A couple things, and we've recently been recognized as a higher quality agency by a couple different parties. Back when I acquired because of my background history, my history in healthcare, when I acquired the business, I started looking into standards. Healthcare is run by standards. Hospitals and how they practice and how they care for people, there's always standards of the industry. And I wanted to know what the standards of our industry were because I'd always been an inpatient, I'd been in ambulatory, but I hadn't been in the in-home industry. And so I made an effort to get what the standards were for home care from the big organizations, JACO, CHAPS. Those are the ones that those skilled companies get credentialed under. Even though we weren't going to be credentialed, I knew that there had to be documentation, standard documentation that we could follow. And it really has helped us be a notch above what's out there right now to support people. We recently were recognized by our corporate office. We were given the recognition, it's called a 7-star quality recognition. So
wow.
Out of the 600 offices of home helpers, we're at the top
wow.
in regards to the quality. So they had a whole list of criteria that we had to meet in order to get that level, and we just were recognized with that level amongst the corporate office. The other organization that we've just recently been recognized, we just received the A1 rating for the Home Care Standards Bureau. State of Michigan does not license non-medical home care. And so, if you're under a skilled company and JACO they're the indicator that this is a quality agency. There wasn't that kind of situation for us till just recently. Home Care Standards Bureau is a national organization, and it oversees the operations of private duty non-medical home care agencies like us. And there's a whole battery of requirements, ongoing training for our staff, extensive backgrounds are done on our staff before they're even put into someone's home.
So important.
So there's a whole level that we had to reach in regards to all of this different criteria.
Gosh.
And we just a couple months ago were given that. So I think that is a testament to the fact that we are a notch ahead of and above what is out there in the industry right now.
How fortunate for our community to have a company like yours we can call on.
There are only 2 agencies in southeastern Michigan, and we're one of them.
Wow.
That have reached that A1 level with the Home Care Standards Bureau.
Well, I know I have an elderly father in Shelby Township here and a few others in our viewing area, and I know I feel more comfortable having you for when needed.
Thank you.
But speaking of the area, what area do you take care of?
Yeah, because we're a franchise, we do have a geographic area that we cover. Right now we're covering pretty much all of Macomb Township, You know, Shelby is a primary for us, of course, because
Sure.
we're, you know, in Washington, we're down the road.
Right.
But also pretty much all of the remainder of Macomb County. We also do have caregivers, and that's what's important in regards to where we will go geographically. We have to have the right people. We have to have the right caregivers in those areas for me really to service clients in those areas. So if I don't have good people, I won't go into those areas.
Sure.
Some of Rochester, we cover Rochester, Oakland Township, Oxford. We're going all the way up, and we've cared for folks up in the Lapeer area.
Wow. Oh, that's great.
Yeah.
Now, you know, one thing people automatically will start thinking of, you know, what does this cost, and does insurance cover? And can you enlighten our viewers a little bit as to what they're looking at as far as that your service?
Sure. There are a couple because we're not considered medical. Medicare, Blue Cross, all of those medical insurances, you know, that's what those are, medical insurances, they don't pay for what we do. So primarily, folks are paying for this themselves, you know. Long-term care insurance, nowadays we're seeing more and more folks with long-term care policies. And in those policies, it'll itemize how many ADLs or activities of daily living that they have to purchase or are getting in order to get reimbursed for their insurance. So long-term care insurance is one of the kinds of insurances that will pay for our services.
Wow, okay.
Workers' comp insurance
Oh.
will pay for someone to come in the home while the injured worker is recuperating. Auto insurance is another one. Auto insurance will pay for our kind of service while someone's getting better.
You know, this all goes with what I preach at work is pre-planning. Pre-planning your cemetery, pre-planning your funeral.
Sure.
Long-term care, which pays for something like your services. All that is getting your ducks in a row, and I'm constantly, day after day at work, preaching to people, get your ducks in a row, get everything together. It's so important.
It's a hard conversation, and you know that, George.
It is very
for
hard.
Siblings to talk with their parents about, you know, you are getting older, you know, things are inevitable. Get that conversation over with. Talk with them about, you know, what will make their family happy, their loved one happy.
Right, and you know, back when I was talking about caring for our mother, we didn't know what we were doing. You know, had we had professional help, you know, it would have been the best investment for us to have a company like yours come into the home to relieve us, to make some decisions. You know, because we didn't know what we were doing. We had to learn along the way, and I'm sure at times we didn't make the best decision for her.
Yeah, we customize what we do based on what the client's needs are. And one of the other things that makes us different than the other agencies out there, private duty agencies out there, is typically what your first step is, your first encounter with the home care agency is someone who's a marketing person. And that's fine. You need to understand what the agency can do for you, what the costs are, and all these kinds of things. But what we do is a second level. I mean, we have a clinician, a certified nursing assistant, that actually goes out and does a real assessment of what the client's circumstances are. What are their medications? What are their limitations? Do they have indicators or issues with their sight? Do they have, what exactly can we do for them? What kind of task are we to perform when we're out there? We put together a care plan with specifics based on what the client and their family has told us they want.
Well, and you have to be comfortable as the owner of the company to know what services that person needs and that you're able to provide them. Right, and that makes the family feel more comfortable. So is that assessment something that someone would look for in hiring an agency like yours, and what other things?
Right, the kinds of things that people should look for. Are there extensive background checks done of the caregivers, of the employees? Are they employees? Now, when you're an employee of an agency, you're managed, there's ongoing training, and those are the things that people need to look at. What kind of ongoing training does that agency they're interviewing? I recommend interviewing several agencies. You need to feel real comfortable that the person, the company, or the agency you're putting your loved ones in their hands, you're comfortable with them. There's insurance, the level of insurance. Does the agency insure not just the worker, but do they insure the homeowner also.
Oh, good point.
Because homeowners insurance will not pay if a caregiver gets injured on their premises. You have you have to look into that. Most homeowner policies don't. And so the agency should be covering their employees with workers' comp insurance.
Wow.
The agency should have extensive liability coverage in case something transpires. There needs to be auto insurance, especially if you're driving your clients or the caregivers are driving their clients. Right. Those are important things to look into when you're interviewing an
things
agency.
I never would have even thought of.
Mm-hmm.
Wow. Mm-hmm. Boy, we've learned a lot today from you, and how fortunate for our community that we have you to count on when needed.
Well, thank you.
And again, share with our viewers where they can reach you to get more information, please.
Our home helper's office, home helpers and direct is the phone number. The primary phone number is 586-752-3797.
Great, great. Well, I can't thank you enough for being here today.
And thank you for having me.
This was very enlightening.
Thank you very much.
It's been a pleasure. Thank you. Well, folks, this concludes our show for today. As usual, we'll continue to bring you topics and guests that will help you make life's important decisions that will help you protect your loved ones. Thank you, viewers, for tuning in to this episode of Dying to Know.